Great. I think I will make a start then. So I just wanted to say hello and welcome to today's Nutrition and Dietetics MSc Programs Open Day. Thank you so much for joining us. My name is Kate Thomas. I'm the Events Officer for the Faculty of Medical Sciences here at UCL and your chair for today's event. We're hoping this session today will help you to address those course-specific questions you may have and will help you to gain an insight into what it is really like to study on our exciting Nutrition and Dietetics MSc programs here at UCL. I'm also delighted to welcome today's speakers who are here to address any questions you may have about our MSc programs. And there'll be plenty of opportunity for you to ask questions throughout. So please do pop those in the Q&A function and we will answer those for you. This session is being recorded and will be made available following today's events. So now to introduce our speakers, we have Nathan Davis. Nathan is Professor of Biochemistry and Head of Education for the UCL Division of Medicine at UCL. Professor Davis is a registered nutritionist and is also the Director for Nutrition Education at UCL and teaches extensively on biochemistry and metabolism. Anastasia Kalir. Dr. Kalir is an Associate Professor at the UCL Division of Medicine and an Honorary Associate Professor at the UCL Institute of Cardiovascular Science. Anastasia is the course lead for the Obesity and Clinical Nutrition program. She has over 20 years of research and teaching experience in academic institutions in the US and in the UK. And Effie Papada. Dr. Papada is a lecturer in nutrition and one of the program co-leads for the MSc Dietetics program at UCL. She is also a member of the UCL nutrition team lecturing for the MSc Clinical and Public Health Nutrition, MSc Eating Disorders and Clinical Nutrition programs. And Dr. Adrian Brown. Dr. Brown is a Senior Research Fellow and Lecturer in Nutrition and Dietetics in the Center of Obesity Research at UCL. He is a Senior Specialist, Weight Management and Bariatric Dietitian with over 16 years of clinical experience. He is also the Program Co-Lead of the MSc Dietetics program. Thank you so much all, and I will now hand it over to Nathan. Thank you, Nathan.
Thanks, Kate. Very warm welcome to everybody. I'm glad you've joined us here today. And I'm going to give a short overview of our programs and a little bit about the background and the type of things that we teach in the nutrition courses at UCL. So hopefully you can all see the screen now. So welcome to this open event. I'll talk mainly about the MSc in Clinical and Public Health Nutrition, but I'll be talking about and touching on some of the other programs as well. And a lot of the stuff that I will mention in this talk will be relevant to the other programs. So first of all, why would you consider UCL for your postgraduate course? Well, it's simply because we are a fantastic university. We are one of the top-rated universities in the world. Currently, we are ranked at number 8 in the top 10 by the QS World Ranking System. We are always in the top 10. The universities there, they change around a little bit. We go up a little bit, we go down a little bit, but we are consistently, and have been consistently, one of the top-rated universities globally for decades. We're currently number 3 in the World Performance Ranking for scientific papers, and that's because we are a very intensive research-focused university. And the people at UCL who are doing the research are recognized globally, and people at other universities, other companies, and everything around the world cite our research. We really are very, very highly regarded for the work that we do. In terms of students coming to UCL, we currently have the best academic student ratio in the UK. So we are currently run about 10 students to every academic member of staff, which means that we have got good, we're able to have good relationship with our students. We have time for our students. We like to talk to our students. in terms of the sort of funding we bring in. Again, as a very intensive research-focused university, we are competing both at UK national level, international level, European level for funding, and we have been the best performing university in bringing in money for under the EU funding scheme, which fortunately we're still eligible for. Very highly rated for employability. And the other thing you should note is that our graduates also earn a premium compared with other institutions. So people with a UCL degree on your CV does make a difference when you head out into the workplace. And again, in terms of our, in terms of other people citing us, we're the second most cited university in Europe currently. Now, in terms of the actual programs that we teach, both the MSc in Clinical and Public Health Nutrition and the eating disorders and clinical nutrition programs are accredited by the Association of Nutrition. This means that graduates from these programs are eligible to apply for automatically join the register of accredited nutritionists. So this is the professional register, and unfortunately, nutritionist is not a protected title. But there are safeguards in place. There is a standard to which professional nutritionists adhere, and this is maintained and looked after by the Association for Nutrition. We will likely be bringing the obesity and clinical nutrition program also into accreditation this year, because and the dietetics program, which you'll hear about later, is separately accredited to different standards. Just to say that we have a good success rate with our graduates. So the graduates coming out of this program particularly, so this was one of the last years we had reliable data for before the pandemic. You can see that 94.4% of our students were employed. In the following year, we have a sort of similar pattern. So we had something 96% of our graduates employed. Again, this was going into the pandemic though, but only 83 or 84% of them were what we considered to be positive destinations moving up. So they were going either into scientific careers or they were going into sort of PhDs. It's still, it's a very good percentage for this level, especially when you consider that this was the year that the pandemic took hold. So we're very proud of this. Consistently over the last decade, students who come out of our programs have done very well. We're very, very happy to write references for our students, and they go on and have great careers, and they keep in touch with us to tell us how great their careers are. So why would you be interested in studying clinical public health nutrition anyway? Well, it's a great program. We examine nutrition, all stages of life, all problems, health conditions. We look at obesity, disease rate, malnutrition, eating disorders. All these things are kept within this program, though obviously our partner programs in eating disorders and obesity take these on and run them a little bit more, where we focus a little bit more in public health in the program here. All these problems arise from, well, multiple causes, and we do look at the different causes. They come from poverty, they come from poor education, from circumstance, all sorts of things that we look at, but they have impact. They have a massive impact. What you eat has a massive impact on your overall health, your chance of developing serious disease, and your lifespan. And we have great expertise in this here. Again, I've mentioned several times about our research focus, but we actively research into these areas as well. And we're world leaders in researching nutrition, obesity, child health, epidemiology, and psychology related to eating. The one thing is not is that we don't teach food science here. If you're interested in making, better pizzas, better sandwiches, all that type of thing, there are lots of universities that teach that type of course. This is not that. What we teach here is clinical nutrition and understanding how nutrition interacts with the body and is related to health and disease. Why nutrition at all? Well, everyone has to eat. Everyone has an opinion on this. Everyone's got experience, and everyone has got a viewpoint. Unfortunately, a lot of those things are hearsay. A lot of the things that people think they know are not quite right. We're here actually to put the record straight. And what you eat will have a greater impact on your health than anything else you do. We have the environment we live in impacts on us, it impacts on our genetics, it impacts on our metabolism, it impacts on our lifestyle. the biggest environmental factor that we encounter on a day-to-day basis is our food. So your diet affects how you grow, how you develop, the likelihood you develop disease, and your overall lifespan. Not only what you eat, but also what your mother ate, and even what your grandmother ate will all have an impact on your overall health and your lifespan. Overnutrition, undernutrition, malnutrition, where we mean wrong nutrition, will all cause morbidity, that is, ill health and premature mortality. Also, it needs to be said that we've got a long and very proud tradition of studying nutrition at UCL. This is a picture taken back in the 1940s of Sir Jack Drummond, who was UCL's first professor of biochemistry. He was independently well known for his work. He did a huge amount of research in uncovering the structure and the function of vitamins, particularly vitamin A. But really, his legacy is that he led the team, and the team was mainly composed of academics at UCL, other institutions, but UCL formed the core of it, to develop the food ration for the British population during the Second World War. And you look at this was an example of the food ration during the early part of the Second World War, and you would consider this to be actually terrible by what we consider to be on modern dietary standards. If you look at the amount of sugar, fat, butter, cheese, the meat, bacon there that doesn't look particularly healthy. I mean, I think that's not very good. However, the diet was designed to contain everything that people needed to keep them healthy. And when this was supplemented with unlimited amounts of fruit and vegetables that people were largely growing at home, it actually became very good. And this is, this amount here we can see on the table in front of us would have to last an individual for a week. So when you start to spread it out, a little bit of this, supplemented with lots of fruit, lots of vegetables, lots of healthy homegrown stuff, actually the diet became very well. And it's fair to say that if we could take the British population and turn back time and put them all back on a ration system as well, the health of the nation would improve. Wouldn't be very popular, but it would be effective. So we started thinking about malnutrition, what we mean by it, and the statistics when we look at them are incredible. So there is an obesity epidemic. I think we all can acknowledge that, and it is getting progressively worse. And it's not just in adults, it also, we are concerned about what's happening in our children. So if you look back here, these are data from Public Health England, and this is a few years old. This is all pre-pandemic data, but still it bears out that younger generations are becoming obese earlier and then retaining and maintaining that obesity as they go into adulthood. We can see that there's an increased proportion in 4 and 5-year-olds and 10 and 11-year-olds who are not at a healthy weight. And that's an element of concern, and it should be a concern, for everybody. And it matters because not only the health of those individuals affected, but it costs society as well. So obesity costs the wider society something, somewhere between 25 and now 35 billion pounds a year. Yes, the NHS spends a huge amount of money on overweight and obesity related ill health. That was back in 2015. We can probably expect to double that number now. And we spend more on the treatment of obesity and diabetes than we do on all these other essential services. And that's it's quite scary when you think about what it costs us as a society. And it's not straightforward. We get lots of people coming in with these ideas. They think that they understand various elements of it. However, when we start to drill down into it, it's not very straightforward. And we kept things like diabetes. And yes, there is an association that with relating obesity to diabetes. However, it is not universally true. There are people who are not obese who develop diabetes. There are people who are obese who don't develop diabetes. And understanding why and the metabolic consequences of these sort of lifestyle choices, does make a big difference. And we will drill back. We do drill into this as part of the course. We hope that everybody will understand how metabolism works, and then they can then see why these different conditions develop. Other things that will happen on the course, well, we are fortunate to be surrounded by world-class hospitals who are our partner hospitals. So UCL partners include UCLH, Great Ormond Street, we've got the Royal Free Hospital, as well as various specialist hospitals, things like the dental hospital and the ear hospital, things like this. So that means that we have a lot of interaction with our clinical colleagues. A lot of the people in these hospitals are clinical academics. They will come and they will teach on our program, and we are able to send our students into the hospitals, both for observation visits. They can join ward rounds, they can join clinics, they can see, the use of nutrition in modern clinical practice. And also there's an opportunity for them to undertake, elements of a research project in there as well. In these photographs here, there's one on the left-hand side. You can see this is some of our students who were in the catering department of University College Hospital, and they were taste testing some of the things that are on offer. These are supplemental foods to help people post-surgery. We also do things where we do lots of training, we do laboratory work, and we expect our students to learn key skills about measuring body composition and understanding energy expenditure. Benefits of our program? Well, we do provide a comprehensive education, thorough grounding, nutrition science, everything related to diet, lifestyle, and the modern patterns of disease. We encourage everyone to develop a holistic approach to obesity and malnutrition in modern society, coming from both the biomedical, metabolic standpoint, but also understanding societal influences. The knowledge and skills that we provide enable you to engage with healthcare professionals, nutritional scientists, whatever sphere you have to work in, clinical spheres, social spheres, public health spheres, in companies, in science writing, whatever it happens to be, you could be well equipped to hold discussions and to make sense of the environment that you choose to work in. I'll come back to it again, that we are world leaders in this. We're world leaders in biomedical research. We offer a large variety of expert teaching. We bring in a wide range of teachers, not just the staff who are here to talk to you today, but we bring in specialists, we bring in researchers, we bring in clinicians, we bring in dietitians, we bring in nurses. Anybody that we consider will add to the knowledge that we are trying to provide, we will go out and we will find them. So how do we structure our course? Well, it is a full-time course, but we organize it so that we have 2 full days of teaching a week, and then the other days are supplemented with some of the meetings, the opportunity for private study, assessments, research, that type of thing. So in term 1, we teach modules that sort of bring you up to speed. We have a lot of people coming in from different backgrounds. So our first module in the first term is about fundamentals. So that's where we want everybody to understand the really important building blocks to understand metabolism. So that was on Wednesday in the first part of term. In the second part of term, depending on the program you're on, you will either do disease-related malnutrition, so that's clinical and public health nutrition, but also the obesity students, obesity and clinical nutrition students do that. If you're on an eating disorders program, the second part of term 1 on Wednesdays will be taken up by clinical science. So that's understanding the background to eating disorders. We then teach Fridays. So Fridays, everybody, all of our nutrition students across all the programs undertake research methods and practical nutrition assessment. So those are core skills that you need to understand research, to interpret research, to present research, and also the skills you need in order to gather information. So in there we teach things like dietary analysis, conducting interviews, laboratory skills, anthropometry, so you can measure body composition. All that takes place, and that runs throughout the whole of term 1 on Fridays for everybody. In term 2, first part of the term, first half of the term, is therapeutic aspects of nutrition. Again, all of our nutrition students do this, and this is where we look at the clinical aspects of nutrition and how clinical services adjust nutrition relevant to the conditions that they're looking at. Second part of term 2 on Wednesdays, you either do nutrition and public health, or you would do eating disorders treatment if you're an eating disorder student. Eating disorders treatment is exactly what it sounds like. It's all about treatment modalities and how those are implemented and how success is evaluated. On Fridays in term 2, it's malnutrition in the community for clinical public health students and eating disorder students. and that's followed then by disease and disordered eating on Fridays, again for clinical and public health and disorder students. Obesity and clinical nutrition students will do those modules in green at the bottom. Once we get to term 3, which starts after the Easter break, all of our students will engage in a research project. And that research project will be working either in a lab or with some of our researchers or in one of our partner hospitals or in a community-based project. And that will take them then through May, June, July, and they will write up and submit a research dissertation by the end of August. It's a busy year. There's a lot of content in there. It does fill your time. Even though we're only teaching 2 days a week, you would expect to be busy at least 5 days a week. We don't just give lectures, we have a variety of education delivery. We do a lot of flipped work where we will present the information to you first, and we will use the time with our students in order to have workshops or discussions. In that way, we can really make sure that we have a good level of understanding, and there's the opportunity to engage and ask the questions that to clarify the bits and pieces you don't know. We do problem-based learning activities, are very popular. You're given a case, you're given something that you have to drill down into. You'll go away, you're doing some research, and we'll come back, and then again, your workshop and have a discussion on it. Lots of stuff we do with case studies, lots of stuff that comes out of our hospitals and our partners that are good for discussion. We have coursework. A lot of the program, a lot of the modules, are coursework focused. Help you develop sort of key skills. We have exams as well, but there are multiple elements to every module we do. The research project was very popular. It's one of the actually sort of main attractions, I think, to come to UCL, is have the opportunity to actually sort of work in one of the research teams, do something that's novel, new, and exciting. Obviously, I mentioned that we do laboratory practicals. We have some simulated work, field trips. It's been a little bit tricky during the pandemics and the lockdowns, but we are now starting to get back into this and going out and visiting community projects. Going to food banks, looking at charities and other places, so we can get an idea really of how nutrition is translated into the community. And I'll stop there, and I'm not sure, Kate, whether you want to do any questions now or whether you'd like to store them up for a little bit later on.
I think maybe we will store them up because we've got the Q&A function available. So if you do have any questions, pop them in there, and then after the presentations, we will go to the Q&A part. But yes, thank you so much, Nathan. That was fantastic. And now we will hand over to Dr. Kalia.
Can you see my screen?
Yep.
Hopefully not the camera. Good. So hello, everyone. My name is Anastasia Kalea, and I'm an associate professor in teaching at UCL, and I'm the academic program director for the MSc in Obesity and Clinical Nutrition. We did develop a specific program looking on obesity, and that came as an idea after lots of requests from our students from other programs to look specifically in this area and be trained in it. And this is not random. We know that around 1.25 million people in the UK are thought to be living with a variety of eating disorders and problems with eating, and over half of adults in the UK live with overweight or obesity. So understanding the evidence base between diet, nutrition, and its wider impact on health is essential. And this program offers specialized training in the clinical and scientific basis of overnutrition and obesity, but we also look at public health measures, and we look deeply in therapeutic approaches around prevention and treatment of obesity. And I have to say that I have to brag a little bit that no other university is able to offer such a wide range of high caliber partners and experts, both scientific but also clinical, in the field of obesity. And this is what is unique about this program. Students have the opportunity to be involved with some of these partners, and these partners can be the UCLH Bariatric Center for Weight Management and Metabolic Surgery, the Obesity Policy Research Unit, the UCLA Institute of Epidemiology and Healthcare, experts in behavioral sciences, but also the Bartlett faculty. And one important, we know that one important barrier that impedes optimal care delivery to patients that live with obesity is weight bias and stigma. And this program was developed to teach and train future healthcare professionals about that unrecognized transmission of attitudes and beliefs that relate to patient care and the professional values and clinical training. So we're trying to change the narrative of obesity, to try to teach the narrative, the evidence-based, but also follow an approach while doing that, which will affect the quality, hopefully, of clinical management of this chronic disease. We do talk about obesity because it is a worldwide problem that nearly tripled since the late 70s. Some of the statistics that you can see here say that in 2016, more than 1.9 billion adults over 18 years of age are living with overweight. And of these, around 650 million are living with obesity. Around 40% of adults over 18 years of age had higher weight than the normal BMI ranges in 2016, and 13% of them were living with obesity. Most of the world's population live in countries where overweight and obesity leads to higher mortality to people than underweight. So based on these existing prevalence and trends and epidemiological evidence that we have that link obesity with a range of physical but also psychosocial health conditions, it is reasonable to describe obesity as a public health emergency. And this is why we need healthcare professionals that are trained in this, how to deal with that kind of patients, how to manage that disease properly. These are the numbers that I just showed you. And in order to engage the right group of experts to work in preventing but also treating this disease, we need to work together and speak the same language and appreciate the same evidence. Now, it does seem to affect this country quite a lot. Around 2/3 of adults in England are classified as living with obesity. And this is a BMI index of over 25 kilograms per square meter, or living with overweight, or living with obesity. That's a BMI over 30 kilograms per square meter. And this data from 2015. And we see the trends increasing both in men, but also in women. The rate of increase has somehow slowed down since 2001, although the trend is still upwards to a point that we need to do something about it. And you do see these statistics here. It seems to be a disease that also affects children, and we do talk in this course about looking at this population group in order to design appropriate interventions. Now, this is a slide that is borrowed from Professor Rachel Batterham, who's the research program lead for this course, and that presents a number of medical conditions that are associated with obesity. The evidence is overwhelming on how strong is the association of increased adiposity with conditions like insulin resistance, glucose intolerance, diabetes, hypertension, dyslipidemia, sleep apnea, arthritis, hyperuricemia, gallbladder disease, and also a variety of certain types of cancer. And all these comorbidities are associated with obesity. And of course, it's not an easy problem to solve. This image represents that complexity of the problem. This image is from a report which was produced in the UK by the UK government's Foresight program on tackling obesities and future choices. And it developed scenarios of the future to explore how the UK could respond to rising levels of obesity. This is called the Obesity System Map, which is what we explore through this course. It sometimes derided for its complexity, but it is instrumental in creating a far more balanced perspective about the roles of the individual and the environment. So we look a lot into this course about the environment the food environment that we live, that would encourage different eating habits and the genetic predisposition of some individuals to respond differently in different types of food environments. To be more specific about it, we do know that there are independent contributions of a poor diet and physical inactivity that would drive excess weight gain. We will talk about awareness that some individuals are biologically more susceptible to weight gain. So we'll discuss a lot about genetics. We will look at the impact of the environment on personal choices, and we will look a lot at this interaction between the environment and the individual. This map also helps to visualize the concept of a whole systems approach, which we follow through this course, and would allow you being trained through this to interact with policymakers, if that is the career path that you aspire to follow, and instead of focusing on single initiatives, to look at this whole systems approach as a solution. Our goal for our graduates is to develop a thorough grounding in the theory and the application of nutrition in prevention, but also in treatment of obesity and its complications. And we expect you to develop a good understanding of the causes, the current best practice for treating overweight and obesity, as observed in clinical practice. And by the time you graduate, you should be knowledgeable in public health nutrition issues, but also in strategies employed both at national, but also at local levels. You will be exposed to specialist knowledge as well, and to research on obesity and its complications. And especially during your research project, you will have the opportunity to look specifically at a research area and develop at the same time a range of intellectual, academic, practical, and research skills as part of the course. But primarily, you will be able to filter and interpret, evaluate the academic literature and the evidence in this area. And our course follows the tiers of UK weight management after you are exposed to basics of metabolism and disease processes and pathological processes of certain diseases. When we look at obesity, we look at environmental and population-wide services and initiatives, and then we look at multi-component weight management services. We look at specialist assessment, but also bariatric surgery as an option. Now, students undertake modules to the value of 180 credits, and similar to the course that was presented by Professor Nathan Davis, you have 8 compulsory modules that will compose 120 credits, and then your dissertation, your research project will be 60 credits. There are no elective or optional modules, or modules are compulsory. So you will start your term 1 with fundamentals of nutrition and metabolism in the first part of term 1 on a Wednesday, and then on Friday we teach practical nutrition assessment and research methods. And the later part of term 1 on a Wednesday we will teach disease-related malnutrition. And then after the winter break, you will attend 2 modules on bespoke for the obesity students, the obesity program students, so obesity and weight management. And this is the part that we have clinical observations. We talk about therapeutic aspects of nutrition, and then also we will talk about public health nutrition and disease and disordered eating later in the course. Now, in the very last part, after April, you will resume your teaching, and you will, along with your remaining assessments, you will focus on your research projects. And part-time students will be able to attend 4 modules each year, but the research project will be conducted in year 2. Now, as I said, as part of module 0105, the obesity and weight management, we do have the opportunity for you not to have placements, to clarify that, to have clinical observations on face-to-face clinics or online clinics with patients. And you will have the opportunity to interact with patients through your course in many other different modules. This is usually accompanied by a Q&A session with the key staff members. So you might have a clinic with a surgeon or with a dietitian, and you will get to follow the patient's path. The projects that we offer, the research projects, you will have a variety of options. It can be a project focused on obesity, or if there is another area along clinical nutrition, along your clinical nutrition interest that deviates from that, and it's a little bit different, you still have the opportunity to look at that. We do encourage students to tell us about their passion, to tell us about their specific interests. And we have plenty of experts at UCL to look for a project to look for an expert that can support you in this research area. And we do encourage that autonomy on deciding on your research project. And to wrap up here, I have an example of a research project that came out from a student's idea. They wanted to look how we could reduce waste stigma in healthcare education, and we conducted a systematic review along with other colleagues at UCL, and published the manuscript in Obesity Reviews, but also used this evidence to design and optimize lots of the training we conduct in this course. And this was nicely picked up by the media. So from the publication, the visibility of these results that came again from a project that was inspired by a student was really nice to see. Thank you very much for your attention, and I'm happy to answer your questions in the end.
Thank you so much, Anastasia, for such a fantastic presentation. And so we will have questions shortly after our next presentation. So I can see that you have already started sending them in. So thank you so much. And I will now hand over to Dr. Brown and to Dr. Papada.
Good evening, everybody.
Good evening. Can you see my screen?
Yep.
Okay. Thank you very much for joining our open day today. So my name is Dr. Stavia Papada, and I am a dietitian, a registered dietitian, and a lecturer in nutrition at UCL. And together with Dr. Adrian Brown, I am one of the program co-leads for the MSc in Dietetics. Dr. Brown, would you like to introduce yourself?
Thank you, Dr. Papada. Good evening, everyone. Thank you so much for joining us. My name is Adrian Brown. I am the other co-lead for the dietetic program. I am a senior research fellow in nutrition and dietetics, and I am a senior weight management and bariatric dietitian. So worked in the NHS for many years. So really lovely to meet everybody today.
Thank you very much, Dr. Brown. So before we present you today an overview of our program, I would like to first explain a little bit what dietetics is, what do dietitians do, and areas they are involved in. Excuse me. So dietetics is the science of how nutrition affects our health, and it seems that its importance is increasing during the last decades. There is plenty of evidence showing that our diet is linked with the risk for developing non-communicable diseases such as diabetes, obesity, and cardiovascular disease. But dietetics is not limited only on the management and prevention of these diseases, as it can also play a significant role in the management of clinical conditions such as gastrointestinal diseases, liver and renal diseases, and many more. These are only some of the reasons why dietitians are crucial members of the healthcare professionals community. And according to the British Dietetic Association, they are qualified and regulated health professionals that assess, diagnose, treat dietary and nutritional problems at an individual and a wider public health level. It is also very important to mention here that the title dietitian is the only food and nutrition title that is protected by law. Only those registered with our statutory regulator, the Health and Care Professions Council, the HCPC, can use this title. A little bit more detail on what do dietitians do. So they interpret the science of nutrition to improve health and treat diseases by educating, giving practical and personalized advice to clients, patients, carers, and colleagues, depending on the environments that they will work in. They advise and help to maintain nutritional status when individuals want to trial dietary interventions such as exclusions diet, nutritional supplementation, or any other dietary interventions. And they also use recognized methodologies to critically appraise the evidence base, which includes all forms of evidence and research to inform their advice. It is also very important to highlight the different areas where dietitian can work, because often we think that dietitians can only work in clinical environments such as hospitals. This is obviously a career option that a great proportion of dietitians may choose, but this is not the only pathway, as they can also work in private practice, in the food industry, in media and communications, in research and academia, in case they choose the academic pathway, in sports sector, in charities, and of course in public health. And as our program is newly developed, we have ensured that we're preparing our students for these various emerging roles they can work in. So why study dietetics at UCL? Our course has been developed in a way that will equip you to become a competent, passionate, and autonomous dietitian. You will be able to deliver evidence-based, service user-centered dietetic care, and also innovative public health nutrition initiatives across a range of groups and working environments. And you will also gain the confidence, knowledge, and skills to translate all this complex scientific evidence about food, health, and disease, and human behavior, so that you can assess, diagnose, and treat nutritional related problems, both at the individual level and also in the population level as well. Our program is 2-year long, and it is structured around both academic and practice placement learning, which are very strongly combined, so that we can provide the students with the academic knowledge and also the practical experience that they will need to work in a range of settings. You will study key concepts relevant to nutrition and dietetic theory and practice, both in health and pathological conditions. And another important part of the course are the professional skills that you will develop, including reflective practice and ethical considerations. And now let's see a little bit in more detail what does the course cover. So you will gain knowledge on nutrition and metabolism in health and disease and across the different life stages. You will learn about research methods in nutrition and also about nutritional assessment. We will cover aspects of malnutrition, and we will cover also topics of clinical practice in 3 dedicated modules, as well as professional practice. And also a big component of the course is around communication skills, which are a crucial aspect of the professional skills that you will require as a dietitian. Last but not least, you will have the opportunity to experiment in our brand new state-of-the-art teaching kitchen on modifying the nutritional content of the recipe, the texture of food, and on different specialized diets that accommodate the needs of specific patient populations. So you can see now, you can see in this picture some of our students' efforts and specialize in experimenting in different specialized diets. I will now pass on to Dr. Brown, who will present more details on our timetable and our placement overview. Thank you very much.
Thank you very much, Dr. Paddy. If you can move on to the next slide, that would be great. So as you will see from this course, Dr. Papada has very nicely gone through a lot of the modules that our course will involve, particularly that we do have shared modules. So exactly the same as the MSc in Obesity and Public Health, we have shared modules between ourselves, and they're the ones in black. So in the first year, in the first term, you have 4 separate modules. 2 of them are shared, which is fundamentals of nutrition and metabolism and practical nutritional assessment. And the other 2 modules are specifically around professional practice in dietetics. And that's really around the professionalism and understanding all those core requirements of becoming a registered healthcare professional. In year 2, term 2, that's January to March, again, you'll be involved in the therapeutics aspects of nutrition and malnutrition in the community. And then the specific ones related to dietetics is the continuation of professional practice in dietetics that runs throughout the whole year. And then what we do is we introduce lifestyle management prevention and food environment, which really starts to unpick those core diseases that you're going to be seeing within your dietetic practice. Term 3 will involve more of the same. So we move on to our placements within term 3, which is April to July, and you continue with the professional practice. And I'll be talking about those placements in the next couple of slides. So if you move on to the next slide. And then this is term 2, and term 2 starts off with placement 2B, and then progresses onto our next module, which is really professional practice 3, which is advanced dietetic practice, really covering those really advanced skills within dietetic practice. And then we continue and start off professional practice 2. Then you have your final placement, which I'll be discussing in a minute, which is January to March, which is placement 3. And then finally, as with the MSc, with both of the other MScs, in public health and obesity, you do a research project to make it a master's level degree. So what we're going to do now is we're going to talk a little bit about the placements. Now, the placements form a huge part of our course. If you'd like to move on. The core aspect is that they would take 1,000 hours of your time. So in order to become a registered dietitian, this is the unique aspect of this. It's not just about the teaching, it's about learning those core dietetic skills to be able to then become a dietitian and deliver patient-centered care at the end. Our courses are slightly different than others that you might see, as well. Our placements are split up into 4. We use what we call a no-can-do model. So right at the start, which is placement 1 is 75 hours or equivalent to 10 days. And that's really getting you to start to get to understand or know some of the core skills that you might require to become a dietitian. You'll spend some of the time in an NHS setting, and then half the day a week, every other week, with our nutrition support team. So you get an opportunity right at the start to actually see some patients on ward. And then the rest of the time is simulation work with myself and Dr. Papada, really working through those core skills such as dietary assessment that will help you to build up your confidence to be able to do that directly with a patient in your next placement. Placement 2A is 375 hours or equivalent to 50 days. And this is in a traditional setting. So you'll go into either a hospital or an outpatient setting. And what that is that's about starting to develop those core skills and starting to deliver that directly to patients. So it's 3 days a week, and this is unique that we're doing these part-time. These are usually Tuesday, Wednesday, and Thursday. And then the rest of the time, what you do is you come back into the university and you spend some time with myself and Dr. Papada doing some simulation work to really work on those core skills that you've been learning in the clinical setting, but also to help to reflect, as Dr. Papada said, around those core skills. So really sort of developing as we go on. Placement 2B is unique. What we really do is we know that not every dietitian wants to work in the NHS or in healthcare. and that some people might actually want to go into non-traditional settings, for example, like media or industry, or for example, where myself and Dr. Papada have moved into, which is academia as well. And what this does is this is 20 days or equivalent to 150 hours. And what you do is you build up a project within that and again, continue to develop those dietetic skills. Your final placement is placement 3. And this is in your final year. This is a 12-week full-time placement equivalent to 450 hours. And this is done in a traditional setting, really getting you to become an autonomous dietitian by the end. So by the end, that will really mean that those skills that you have, you're then able to progress to becoming a registered dietitian with the Healthcare Professions Council. Next slide, please. And just to sort of reflect, this is obviously, as Effie said, this is a new course, but we are fully compliant with the BDA curriculum guidance and also registered with the Healthcare Professions Council to make sure that we are a registered course that at the end, as you said, you can register, if wish, to become a healthcare professional as a dietitian. So I thank you very much for listening. I now obviously open it up to the floor and I believe the rest of the speakers are going to be coming back.
Thank you very much.
Thank you so much, Effie and Adrian, for your presentation. And yes, you're right. So we are going to open the floor to your questions. I can see that they have been coming in throughout the presentations, which is fantastic. And also thank you to our speakers who have already answered a few of those. So, but we can obviously go back and revisit those, but I will start with the first one that we have from Lily. So can you give some examples of research project titles? So I don't know if perhaps Nathan, you would like to start with that one.
Yeah, so very happy to. So it's very hard within just a few minutes to try and capture the range of projects that we do. We could take an hour just listing them. For example, this year we're going to give around about 125 nutrition or dietetic focused projects out. They will cover everything. We have people doing community stuff. We have people doing monitoring of food banks. We have people working with Great Ormond Street, assessing the effectiveness of drug and nutrition regimens. We have got people in UCLH, we've got people looking at various specific diets for inflammatory bowel disease. We've got people at the Royal Free Hospital who are looking at muscle wasting in chronic disease. We've got transplant workups. We have got people in eating disorders programs looking at the effectiveness and also looking at things like the impact of mobile apps and whether they impact or not on eating disorders. We have got people doing exercise programs, looking at to see whether people who are elite athletes are more or less likely to develop, sort of muscle disorders depending on the focus of their diet. I mean, we could spend all day. We have sent people off to different countries. We have people trekking in the foothills of India in community projects. We've had people in the Gambia looking at iron supplementation. We have had people in companies. It's impossible to try and pin this down. Essentially, we can generally find a project topic to match with most people's interests. UCL is huge and our network is 10 times bigger. So the simple answer is no. We can't give you, a comprehensive list, but I can say that we find something for everybody every year.
Fantastic, thank you, Nathan. And I don't know if anyone else wanted to chip in on any others. I know obviously Anastasia, you covered a research project example, but yeah, if anyone had any other topics or titles to add in. No, I think
we'll have to push
we
through.
could be here all day maybe answering that question. Yeah. No problem. Well, hopefully that answered that one for you, Lily. I will move on to the next question. So this is a three-part, so 3 questions from Monica. So the first part is asking, how do you choose between the obesity focus versus eating disorder focus versus public health focus? So maybe Monica is deciding which course to choose potentially. So don't know, Anastasia, I can see you typing. So would you like to answer that one maybe?
I was typing, so shall I ask Nathan, do you want to answer that?
Yeah, Nathan again, if you're happy.
Okay, so really, the program's got low overlap. A lot of the modules that we've mentioned, are common each one. So in the first instance, you can start on any of the programs and switch between them. That's very straightforward. The entry criteria actually are broadly similar across our programs. And so once you're in, changing between them is not a problem. We quite often have people who start in eating disorders and want to do clinical public health or obesity or something along those lines, and we move them back and forth. I would say, go with, what you think is your particular passion. When you're applying, if you get in and you find this does not quite fit and one of the others perhaps a better fit, quite often we can change. The only one that we cannot easily change into is dietetics. And that's because we have got, because it's a regulated program, because it's a healthcare profession program, we have quite strict entry criteria and it has to be done through a professional process. So it's for people to move out of that. They think dietetics is not for them and they want to go to one of the others. That's okay. Going into dietetics, it's a little bit more complicated. Perhaps some of these others we could just whiz through a little bit. The one about becoming a member of the Association of Nutrition, that's very straightforward. Our course finishes, we have the exam board. Once the exam board ratified all of our degrees, we give a list to the Association of Nutrition, and all that happens then is you apply, and if your name's on that list, you have direct entry. You don't guarantee entry because they have professional standards. So if, for example, you have a past career as a mass murderer or something like that, then they don't tend to let people in. But provided that you're a person of good character, it's very straightforward. Our typical applicant for the masters, this is Lily's question, it's incredibly varied. The general entry criteria on our website, it's people with a biomedical nutrition focused degree, although we have had people with some professional experience who have done all sorts of other things previously. So we're not absolutely super rigid in who we let in. If you can back up an interest with relevant experience and a degree that at least lends itself to the area, we will consider you. Perhaps the next one we can hand over to Adrian or Effie, which is about studying dietetics to go into research. So you're very quiet, Adrian.
Yes, yeah.
Mm-hmm.
Yes, ultimately, yes, 100%. I mean, I actually followed that program. I studied dietetics, became a clinical dietitian, and then moved into research and academia afterwards. So yes, it will develop those skills. And the MSc project really builds those research skills and brings it together. But as Professor Davies said right at the start, within that first year, you do and learn around those core research skills. So very much so, you'll be able to move into research and academia. Effie?
Totally agree with you, Adrian. I mean, you will sure develop your research skills as well. So why not choose this program if you want to go to research and academia? I mean, as Dr. Brown mentioned, I also did the same. I also followed the same pathway. I finished my dietetics degree and then continued with an MSc and then my PhD. So I went straight to that pathway.
Fantastic. And shall we go for the next question? So this is a question just asking, is it possible and suited for a Bachelor of Nutrition with less than a year experience as a research assistant to apply for the MSc Obesity and Clinical Nutrition program? Or is it better to apply for the MSc Clinical and Public Health Nutrition program if they want to pursue the study about obesity? So I think, Anastasia, if I hand over to you for that one.
So this question is from I'm trying to find this. Who submitted this?
Various. Zulfa, you got it?
Yes.
Perfect.
So if it's possible for a bachelor in nutrition with less than a year experience as a research assistant to apply for the MSc in obesity. Well, for the MSc in obesity and clinical nutrition, we're looking for people that have a good understanding of metabolism to continue with their studies. So any kind of background like nutrition or biomedical sciences or biology, any kind of background that exposed you to metabolic processes would be appropriate for you to submit your papers for this MSc. It's not like the MSc in Dietetics that you need to demonstrate that you have some experience, some understanding about the dietetics profession. This is something else. For the MSc in obesity, yes, is the answer. It is possible for you to apply. And I had another question that said, is the MSc in obesity appropriate for dietitians? The MSc in obesity was designed actually for healthcare professionals that are looking to work specifically in the area of obesity. So the answer is yes, if this is something that you want to pursue later on.
Fantastic. And we do have a question for dietetics, actually. So for the dietetics MSc, do you accept students who have a BSc in psychology? I don't know, Effie or Adrian?
I would say it depends on the content of the BSc in psychology. If you have covered some kind of biochemistry or physiology, it depends on what you have been exposed to in the past. I don't know, Dr. Brown, would you like to suggest?
Dr. Papada, yes. I guess it's important to have covered some aspects of nutrition. This is a very fast-paced course. It's a 2-year course that covers the BSc degree that's traditionally been 4 years in 2 years. So it's very fast-paced. So it's to put you on the same level as everyone else. It's important you, as Dr. Claire said, you getting those core skills, those core important skills around nutrition, biochemistry is absolutely key. So Phil, we do encourage you to contact us outside of this, and we can look at manuscripts and discuss those to see if they're appropriate.
Fantastic. And another question, which is, what's the difference between dietetics and nutrition?
So
Effie.
I would say that as we mentioned, the dietitians are the only title that is protected by law, and it is regulated by the HCPC. So dietitians are the healthcare professionals that are able to assess, diagnose, and treat diseases. So this is the difference, actually, that with the nutrition part. But Dr. Brown, anything else to add?
Great definition.
Great. And the next question, are exams for the nutrition master's courses conducted online or in person? So maybe Nathan or Natasha, if you want to.
Natasha, you put your hand up for this one.
Yeah, we used to have online exams during COVID. Now, during the pandemic, so now we're back to face-to-face exams and face-to-face presentations. But every module has a combination of assessments, and in many cases, you may need to submit a coursework, so something like an essay or a report, or looking at scientific data and producing a scientific report. But the unseen exam would be face-to-face. We do have, through the modules, we have an open book exam, which is taking at your own time, but mostly the unseen assessments, the unseen exams are face-to-face.
Okay, fantastic. And the next question is, what is the size of the dietetics MSc cohort? So again, Effie or Adrian?
We have started last academic year with a small cohort due to the fact that we need to ensure that we have enough placement positions across London. So we have started last year with 6 students, and this new academic year we have increased our numbers to 10 students. So we're gradually increasing the numbers. So currently our new cohort consists of 10 students.
And just to
we are going.
Sorry.
I was going to probably say the same thing. We're going up to 15 this year, and then we'll be increasing further after that. But it's a stepwise approach depending on the clinical placement opportunities that we have.
Very much so. And I know that there's another question around the number of applicants to places. As they said, so to give you sort of a reference, we had around over 150 applications to 10 places last year. So it's incredibly competitive process. There was another question that I do believe was around experience, which we do encourage you to attempt to get some experience if you can with a dietitian, whether that be privately or with the NHS, to actually start to understand what a dietitian actually does, because it's very important that you do that beforehand, and that we as myself and Dr. Papada get the sense that you understand what the role is as a dietitian, but also it's around your transferable skills. So that's an important aspect. If you can't get the experience, what transferable skills do you have that you know you can apply to dietetics, and you know about dietetics? And that personal statement should reflect some of those aspects to help you to get an interview and hopefully a place on the course. Dr. Papada, did you have?
No, thank you. Thank you, Dr. Brown. Thank you very much.
Okay. First, I think we've got a lot of questions trying to work our way through. The next question was about the dietetics program, place of research project. Can you do something else? No is the simple answer. The placements are the placements. The research project is the research project. There's separate elements of the program, and our students have to complete both. Question then moving on gut microbiota within dietetics course. The gut microbiota comes up in multiple elements of all of our programs. We study it extensively, and it's not just the gut microbiome. Actually, we look at other microbiomes in different parts of the body, so that in the mouth is different in the gut. And, all of these are factored in and covered as part of the program. I think Adrian already covered the sort of experience for dietetics, and probably move that one forward a little bit. The dietetics course have an opportunity to work with a research team, research project. No, as I've just said, there is an element where people go on placement, and there is an element where they do a research project. Because our master's degrees all have a research element to them, all of our master's students do a research project, which includes a dietitian, and it's separate elements to the program. So yes, you would have the opportunity to work with one of our research teams. Okay, question then, Adrian or Effie, about biochemistry for bachelor's degree. Would that be okay for dietetics?
Yes.
Yep. Okay. So the positive one for that.
It's just an appropriate 2-1. Yes. Or above.
And then medical biosciences undergraduate for dietetics as well. Yes. Yep. Okay. Grand. That's excellent. Okay. So in terms of eating disorders, unfortunately, our colleague who runs the eating disorders program is unavailable this afternoon. You can contact us. I put an email address in earlier on. If you look in the answer questions, or we can put that back up again, you can get in touch with us. We can give you a specific example about the eating disorders course. But the eating disorders course is fantastic. It's the only one of its kind in the world. There isn't another eating disorders nutrition masters out there anywhere. What it covers is the causes of eating disorders, or the associations of eating disorders, how to identify, how to diagnose, and how to treat them. There are specialist observation visits in eating disorders treatment centres, where you get to go and see firsthand how this is done. It really is so excellent. It goes along with all the core stuff we're talking about: understanding metabolism, understanding what happens in nutrition and in the body, and the rest of it. And then, of course, eating disorders lay over the top of this, and how that has a major impact. But please, for specific questions, drop us an email. We'd be happy to put you in touch with the course leads. Okay, psychology we've already answered, I think, earlier. It depends on the program, but please get in touch. You can send us your transcript and we will have a look at it. Biomedical degree, dietetics, yep, that one's fine. We've already answered a similar one to that. Do you have a part-time course? No, unfortunately we don't. Well, the eating disorders program we do offer with a part-time option. So if you wanted to study eating disorders and clinical nutrition, that's the only one that we're currently offering as part-time. The others, it's full-time. It's because there's so much interaction between the different modules that really we think it's a better experience for students to be there, sort of full-time basis. Eating disorders are a little bit different because we do get quite a lot of people specialize or clinically work in that area, and there's a limited amount of time they can get off in order to do these programs. Okay. Bachelor of Culinary Nutrition. Would you recommend a specific course that would increase the chance of acceptance? I think perhaps the best thing to do for that one is to drop us an email. Let us know exactly what sort of course you're doing, what's been part of it, and then we can help you sort of identify where there might be any gaps. It's a little difficult to say because there's an awful lot of courses out there and we don't know them all that well. Next question, dietetics program, incorporate an interest study eating disorders. One of the options you would have is I'll let Adrian come to this in a moment, but I'm just saying one of the things you could do is you would have the opportunity to do your research area in perhaps working with eating disorders, and that would give you an option. And we do also have some specialist eating disorders placements, which I'm sure Adrian's going to talk about.
Yeah, exactly. Yeah, within our placement 2A and 3, we're very fortunate to have specific eating disorders placements, which actually enables you to engage with young adolescents and adults with eating disorders. So yes, you'll be able to share your passion for eating disorders within those placements.
Okay, next question from Monica, which is the greatest opportunity for employment. Like I say, we have good employment rates coming out of all our programs, so it's a little difficult to say. There is a lack of dietitians currently. There is a lot of vacancies, so people with a dietetics qualification, have got a very good chance of getting a job in dietetics. But then there are also people who qualify in dietetics who want to go and do something else. It's a little difficult, hard to say, depending what you want to do, where you want to go. But I'm going to say that all of our programs have got really good employment and further study rates. So, it's all good. Okay. Traveling requirements. Adrian, Effie, do you want to take that?
I'll pass over to Effie for this one.
So we are trying to locate every student within the area of London. However, as there is a high competition to ensure enough placements across London. So we are doing our best to accommodate you within the area of London. Dr. Brown, anything else to cover?
Yeah, I mean that's where we focus our placement provision, because there's other courses around the country that have those other areas. However, we do have one placement at present time in Brighton, and we're looking at other places just outside London as well. So there might be some travel.
Okay, and so I see we are running quite close to time. I think try and scan down a bit. Dietetics, we get a lot of applications. It's a simple answer. So you're probably thinking, oh, more than 10 applications for every place we're able to offer. It is very competitive, but all our programs have a lot of subscriptions. Just sort of scanned it. Has anybody got any question they particularly like to pick out they think is important? What I would say is that if there's any questions we don't get to, please email us and we will respond to everybody individually.
I can see there's quite a lot of questions around the process of dietetics and actually what happens. So we have a deadline which is rapidly approaching. So if you're planning to apply for this year, we do encourage you to get that application in as soon as possible. That application comes in, and initially we do look at your academic aspects. So we look at whether you have a 2-1, that's a really key aspect, or you have a merit within your master's degree. If you have a master's, so it's important that you have those academic qualifications, but also you have particular aspects like biochemistry, like nutrition, like biology, or you have covered some sort of nutrition within those aspects. You need to write a personal statement. That personal statement is about you, and it's about sharing your experience. That experience can be varied, so whether you don't necessarily have to have had that in healthcare. It might benefit you because you'll be able to share some experiences, but it's about those transferable skills that you have. If you can get some experience within dietetic services, we do encourage you to, but it isn't necessarily a prerequisite. But because it's so competitive, those people that might get those interviews might be those people that have had those opportunities. You then have an interview with members round from here as well, who will be on an interview panel alongside a patient. And then we have around a half-hour interview with yourselves, which we ask you pertinent questions. And then from there, you will be offered a place on the course. As you said, we've got very small numbers, so it's appreciating that. But we feel that those small numbers do mean that you get a really great experience at UCL that you might not get with other larger numbers of courses. So I do encourage you to apply. And Effie, do you have anything to add about the process? But hopefully that's answered a few of those questions that have been going down.
Fantastic. Thank you so much, Adrian. We are actually out of time, so we will have to leave it there. But I just wanted to say thank you so much to our speakers for tackling all those questions. And again, anyone from the audience today, if we weren't able to get to your question, please do email us. We'll be delighted to answer those. So yeah, again, just apologies if we haven't got round to it today. And also just to say thank you so much to you as attendees. We do have a very short survey. If you'll be able to fill that out just very quickly following today's event, that would be fantastic. And we very much hope to see you at UCL soon. So we hope you have a lovely evening in the meantime. So take care, everyone.
Bye, everyone.
Thank you very much. Bye-bye.
Bye.
Bye.
Bye, everyone.